I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It, episode 68. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
We're talking today about living a pain-free lifestyle. How many people want that? Raise your hands. Of course you do. Most people want a pain-free lifestyle. I don't know anybody who wants pain. Pain's not fun. Pain is a warning sign. I say that all the time. Pain is telling you that there's something wrong. And to ignore it, not a good idea. Because pinched nerves or anything that's causing the pain is telling you that there's an issue. Now, if bones are out of alignment, they can rub up against each other and wear out. That's called osteoarthritis. Rheumatoid arthritis is an autoimmune condition. And we've done shows on autoimmune, and I'm sure I'll do more in the future. And if you like what you're hearing, by the way, go to my website, drjoe.com. We have well over 1,000 hours of podcasts, audio, video. We put the audio on SoundCloud so you can download them if you want. A lot of people, when they work out, when they go for long drives, truck drivers, I know we have a huge following of truck drivers around the country and around the world. They'll download the shows and just listen to them as they're driving. So if you're audio responsive, if you like learning by audio, we have audio versions. If you're visual, we have visual. We have the videos there. I have a blog. If you like reading, we have articles that I've written. I have books that I've written. So you can always get whatever works best for you on the website, drjoe.com. But listen to the shows and learn. Because I promise you, I've been doing radio, I've been lecturing now for 35 years, I guess, since I was in college. I always try to put something new in every show so that you learn something. And even my producers who have been with me for years, every show, I said, what'd you learn today? Oh gosh, I learned this, and this. I've never heard that before. So we always try to give you new information so you can walk away from every show, whether it's audio or video, and say, wow, I learned a lot today. So the website's there for you 24 hours a day, drjoe.com. So we're talking about living a pain-free lifestyle. Alcohol, you got to cut down on your alcohol, folks. You shouldn't be drinking. Alcohol destroys brain cells. Your brain controls what? Everything. Your brain sends messages down your spine, out your nerves to every cell in the body. So there's a nerve that makes your heart beat, and your lungs breathe, and your eyes see, and your colon digests food, and your toenails grow. Everything is hardwired to the brain. So if you're chemically damaging the brain, and alcohol is a good example of that, the brain can't tell the body how to work properly. So it's a good idea not to drink alcohol. If you drink, I always negotiate with you. I hate doing this. I'm going to negotiate with you. Like I said, if you eat animal products, make sure they're organic. If you drink, for every drink you have, 3 glasses of water. And the reason is alcohol is a diuretic, which means what? Makes you pee. And you pee, you dehydrate, and muscles shrink, and nerves fire off, and that can increase your pain dramatically. And you're thinking, I'm in so much pain, I just need a glass of wine or a shot of scotch. Short term, yes. Long term makes it substantially worse. So if you're going to drink, for every drink you have, 3 glasses of water. 2 things happen. Number 1, you can drink a lot less. Why? Because you're in the bathroom all night, and you're peeing all night, so you're not going to drink as much. But number 2, you're going to prevent the brain from dehydrating. Your brain releases a chemical called vasopressin, or antidiuretic hormone. And right now, your brain is producing it. Everyone's is. And it prevents you from just peeing all day. Well, alcohol, when you drink, it shuts down your production of antidiuretic hormone, also called vasopressin. Same thing. And so what happens is you then urinate. It doesn't make you pee. It stops you from not peeing. Does that make sense? And so the reason that is your brain is trying to get the alcohol out of the system as quickly as possible so it doesn't get to the brain and cause brain damage. So you have to rehydrate yourself. So don't drink, but if you do, make sure you're drinking your water with it. You got to avoid high fructose corn syrup if you want to live a pain-free lifestyle. What the heck does high fructose corn syrup have to do with pain? High fructose corn syrup, or fructose, has to be converted in the liver into glucose. And in the process of converting fructose into glucose, your body starts producing something called uric acid. Uric acid gets in your joints and it hurts. How many people have gout? It's uric acid, right? I don't have gout, but I mean if you have gout. And so the first thing the doctors will tell you is stay away from meat because meat has purines in it and purines can increase the uric acid levels and that could hurt. Totally agree with that. However, you got to cut out the fructose too. Because fructose converts into uric acid, is a waste product of conversion of uric acid and fructose into glucose. Uric acid is a waste product. That's not the worst part. Uric acid prevents you from producing nitric oxide. Nitric oxide opens up your blood vessels to your brain, to your wrist, to your arm. It increases circulation so it can bring fresh healing blood and nutrients into an injured area and then flush out the waste products. Nitric oxide, many people use it in a nefarious way, not really. It works to help increase the male performance. Let's keep it that way. And women. We all need circulation. And as we get older, our blood vessels become weaker. They're not as flexible, so you don't have good circulation. You may have a bad diet, which clogs up the blood vessels. And in order for romance to occur for men and women, you have to have good blood flow. And so nitric oxide increases blood flow. So a lot of our patients will come in and say, Doc, that nitric oxide, loving it. And yeah, you could use it that way, but there's also medicinal benefits as well. It helps increase circulation. If you're doing fructose, though, fructose is creating uric acid, getting in your joints, and it hurts. Again, we're talking about pain-free lifestyle. Uric acid prevents the production of nitric oxide. Nitric oxide opens up your blood vessels, and that can affect everything, including blood pressure. A lot of patients will take the nitric oxide, open up the blood vessels, and then I'll have their medical doctor monitor their blood pressure and say, maybe we can take you off that blood pressure medication. So that's another trick there, too. White table sugar, plain old white table sugar. I gave a lecture last week, as a matter of fact, to a women's group. And I kind of opened it up to questions. I gave a little bit on cold and flu, and that was the topic. And then we opened up to questions, and of course, the big questions come up. What do you sweeten your foods with? And so I was at a restaurant, so I picked up a packet of white table sugar, and I said, this package is 50% fructose, 50% glucose. So the glucose is being used as a fuel. The fructose has to be converted into glucose, and that's where uric acid comes from. And the nitric oxide production is altered. What about artificial sweetener? Even worse. Because aspartame breaks down to three components: aspartic acid, phenylalanine, and methyl esters. Again, don't worry about the chemistry. Aspartic acid acts like glutamic acid. It causes the nerve fibers to fire faster than they're supposed to, and it can increase your pain. So if you're sucking down diet sodas, and there's over 6,000, last I heard 6,000, probably more than that, products with aspartame in it. Aspartame can increase your pain dramatically. So patients come in, they're drinking diet sodas. I say, got to get off the diet sodas. Of all the things I'll ever teach you, of all the things you'll ever learn from me, the worst thing you can do, the one thing you have to give up is artificial sweetener. All the other ones, well, you have to give them all up, but that's the worst. So artificial sweetener really bad. It causes the nerves to fire faster than it's supposed to. And a lot of people with fibromyalgia are chewing sugar-free gum. They have headaches. One of my coworkers, he comes to us as a patient, and we got rid of his numbness in his feet. He's able to lift his arm normally, and his neck is much better, but he still has headaches. And I've said to him, I won't say his name. He says on the air to his patient, so I can. I said, you got to cut out the gum that you're chewing. It has sugar, it has artificial sweetener in it. And that number one side effect of artificial sweetener is headaches. Oh, I love chewing my gum, Doc. You know, I worry about my breath. You know, we talk a lot as a profession, and we talk to people who don't have bad breath. And I hate to say this. I hate to say this on the air. There are a few gums left, not many, that actually use sugar. So if you have to use a gum, that one. A better choice, they have gums sweetened with stevia now, erythritol. And you can chew those gums. Now, the problem is they don't last as long. But here's my trick. I'm going to let you into the personal life here of Dr. Joe. In my car, in every one of my suitcases, my suit jackets, in my office, I have a bag of cloves. You know, cloves, the things you stick in oranges, make them smell nice around Christmas. Take the clove, you can break off the little bud because it'll just break up in your mouth, and suck on the clove. The clove has chemicals in it that are antibiotic, antiviral, and antifungal, so they kill the bacteria in your mouth, the bad bacteria. It's a great smell, and even when you're close talking to people, what I do is I take the clove and I stick it between my cheek and gum, kind of like chewing tobacco. Stick it between your cheek and gum, and then talk to the person, and then pull it back down, suck on it a little bit, put it back between your cheek and gum. And it's wonderful, because people always say, something smells wonderful around here. What is that? And you just kind of smile, knowing that it's you. So now you're doing something good for yourself as opposed to something bad for yourself and getting a better result. As the cloves start to dissolve, chew them and swallow them. And the reason is cloves have more antioxidants than blueberries. So they're actually good for you. They don't go bad. Eventually, they start to lose some of their flavor, and guess what? You throw them away. Cloves are incredibly cheap. I put them in a little plastic bag, have them all over like I said, all my suit jackets. Because usually if I'm lecturing, I'll have a suit jacket on. I'll pull out a clove at the end of the lecture after talking for an hour, 2, 3, 4 hours, and I'll just suck on my clove, and it's fresh. It's pretty wonderful. So it's pretty cool. what cloves can do. So think about that. That's another fun thing you can do instead of getting an artificial sweetener into your body. Don't use agave nectar. Agave nectar, you may have heard of that as a healthy food. Agave nectar is 85% fructose. So if you're eating plain sugar, table sugar, 50% fructose, 50% glucose, high fructose corn syrup, 55% fructose, agave nectar, 85% fructose. Isn't that crazy? So just because it's touted as a health food doesn't mean it is. Now, I'm going to give it to you straight, man. I want to make sure you know it. Got to talk about supplements. My gosh, this time flies by. We need more time. I don't know how we do this. Well, actually there is. Go to my website, drjoe.com. You've got well over 1,000 hours of audio and video there that in our podcast that you can listen to. Of course, if you have a podcast service, For the Health of It is the name of our podcast. So if you have a Google Play or is it Stitcher, I think it is, any of them, you can go there and look up For the Health of It. That's the name of our podcast there. You could listen to it there as well. Got to talk about supplements. Most people are nutrient deficient. We don't eat enough food to get the nutrients that we need. And even if you do, the soil has been depleted in the past 30 years. 30, 40 years ago, farmers would rotate crops. And every couple of seasons, they'd leave a field empty and let the field regenerate. Now we keep growing the same crops over and over and over again, sucking out all the nutrients. We add artificial fertilizers to it, sometimes synthetic fertilizers. So we can grow a tomato that looks like a tomato. But how many of you are old enough to remember when tomatoes actually had something in them? It was called, what was it? Oh, flavor. That's right. Tomatoes had flavor. And watermelon was juicy and peaches were sweet. Sound like an old man. When I was your age, I remember peaches were sweet. I don't even eat a lot of non-conventional fruit anymore because, if nothing else, it doesn't taste as good. So most of the fruits and vegetables I buy are organic. So I take, personally, Dr. Joe's Super Greens and Dr. Joe's Essential Source every day because they have a lot of minerals in them that can alkalize your system. If you're in pain and you have a high-acid diet, acid is irritating your nervous system. And the acid foods, let's go over them again. Alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. I know, that's your whole diet. Dr. Joe, that's everything I eat. I know that's everything you eat. It's okay. Take a breath. We're going to get you through this. There's 120,000 other foods you can eat. So, if you're eating alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, those are acidic foods. And acid can irritate the nervous system and cause the nerves to fire faster than they're supposed to. So what do? I don't eat a lot of those foods, but I eat Super Greens and Essential Source every day, which the minerals neutralize the acids. It's the minimum amount of nutrients you should take every day. I can't imagine why you wouldn't be taking Super Greens and Essential Source. Relatively inexpensive. For what you're getting, it's incredibly inexpensive. It's maybe just over $2. For a scoop of each is just over $1, so it's $2 and a few pennies. You're spending way more than that on junk food. I know you are. And it's incredible. And once you start taking it, here's the thing. I got to give you a warning. Once you start taking it, chances are you're going to say, like most of my patients do, why didn't I do this sooner? Why did I suffer for so long? And the answer is, I don't know. So Super Greens and Essential Source, absolutely positively necessary for just general lifestyle. And that's on the website, drjoe.com. Your adrenal glands produce, if you cut open an adrenal gland, there's 3 layers to it. One layer produces adrenaline. One layer produces prostaglandins, which control inflammation. And one layer produces your hormones, your sex hormones. So just like the male and female organs can produce sex hormones, the adrenal glands can as well. So you have a backup plan. So taking adrenal support is really important. Now, most of us are burning out our adrenal glands. What are we doing? We're taking stimulants, coffee, tea, colas, chocolates, acid foods, smoking, burns out your adrenal glands. So what do we do about that? I take Dr. Joe's adrenal support to make sure the adrenals are working. And it's one of the reasons my energy is as high as it is at my age. I run circles around my staff that are half my age. And I love it. I make fun of them. Come on, you young kids, get moving. So I take Super Greens and Essential Source and adrenal support. And again, the adrenal support will help the prostaglandin production, which will help reduce inflammation, which can help with the pain. B vitamins. You have to have B vitamins. The nervous system needs B vitamins in order to work properly. Dr. Joe's B complex. I take that every day. That's on the website too, drjoes.com, drjoe.com. Nitric oxide. We talked about that earlier. I actually have a supplement called Dr. Joe's Nitric Oxide. I take 4 capsules a day. That's the dosage. I have to take it in the morning. And the reason is if I take it at night, I can't sleep. I get so much energy. But it increases circulation to all parts of the body. And when vasodilation or blood vessels open up, it brings nutrients into wounded areas and flushes out the waste products. So the body heals faster and it helps with pain control. So all those supplements on my website, drjoe.com, you should be taking them. I don't know how else to make it simpler. And cost-wise, it's so inexpensive compared to what you're getting. It's ridiculous. And another bonus, patients tell me all the time, Dr. Joe, I can't afford not to take your supplements. And I said, why is that? They say, because I eat so much less. Remember, when you're hungry, you're not hungry for food, you're hungry for nutrition. And if you're giving your body tons of super concentrated, high-quality nutrition, you're not going to eat as much food. So a lot of people say they save money by taking the supplements because they're not wasting money on unnecessary food. So for pain management, you have control over that. Now, if you have a pinched nerve, if you have neck pain, back pain, shoulder pain, numbness, tingling, wrist issues, knee, hip, foot, it could be a bone out of place. And all the diet in the world isn't going to put the bone back in place. It'll help bring down inflammation, but you may want to come see us so that we can help put those bones back into their normal position and take the stress off the joint. So in the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. So if you want to get well, so we look at the nervous system from a chiropractic standpoint, digestive system, number 2 reason we see patients, acid reflux, heartburn, burping, gas, bloating. We may have to take the stomach and pull it down away from the diaphragm, actually adjust the stomach. I have that condition, and about 85% of the patients I check have it as well. So if you're sick and tired of being sick and tired, go to my website, drjoe.com. Go right now. Don't waste time. You're going to forget. If you're like me, you're going to forget things. Go to my website, set up an appointment right now. Again, offices in Marietta, Duluth, and Stockbridge. We take most insurances, car accidents, sports injuries, Medicare. Call us with questions. Because the thing that drives me insane, all my doctor friends, and I hang out with a bunch of different branches of healthcare, well, my insurance said that it's not going to cover my surgery. It's not going to cover my physical therapy. It's not going to cover my chiropractic. It's not going to cover my injections, whatever it is. Don't let the insurance company dictate your life. That's just insane. I understand you pay for insurance, but if they're not going to cover it and you need it, either get a new insurance or pay for it out of pocket. Nothing is more valuable than your health. Nothing. I've never known anyone on their deathbed say, wow, I'm really glad I was cheap and didn't go take care of myself. No one's ever said that. And then if you're healthy, chances are you'll make more money, you'll work harder, you'll work smarter, you'll have better relationships. There's no downside to being healthy. So if you're ready to get well, and I think you should, for you, your friends, your family, and your children, go to my website, drjoe.com. You can also get my supplements there. Those are on the website as well, drjoe.com. See how that works out? Pretty simple stuff. So we're talking about living the pain-free lifestyle. You got to get in motion. The body is designed to move. And if you sit around, that can increase your pain levels, which can make you want to sit around more. So whatever level you can do is fine with me. Let's assume you're confined to a wheelchair. Maybe you can move your arms. Take some cans of soup and just move your arms. Do some weights like cans of soup and then build up from there. If you don't have time to exercise, how many people don't have time to exercise? Raise your hands. A lot of you. Think of ways that you can walk. When I come to the studio, I park as far away as I can and walk up the parking ramps and I go up and down the stairs. I forgot something today. I got to the studio, walked back out to my car, walked back in again. So you want to get in motion as much as possible. Make up excuses to walk. Even doing radio shows or TV shows. I stand when I do them. It's a great excuse to stand because you're looking for about 10,000 steps a day. So you can get a pedometer, put it on your belt. Don't use your phone. Your phone has electromagnetic frequencies, and I don't want you carrying your phone close to your body. I've done many shows on that. If you go to the website, drjoe.com, learn about the dangers of cell phones having them close to your body. If you read the instructions on your cell phone, it clearly says, do not put this next to your head. It says it on the instructions. Don't put it next to your head. You can hold it a few inches away from your head, but don't push it against your head. So either use your speaker or use a wired headset. And that's what I do. I use a wired headset with a speaker in it, and then you can talk there. But that's why I don't want you to use your phone. It's your pedometer. Get a pedometer. Cost you maybe $3, $4, maybe at any sporting goods store or carry it. Get a cheap one. It's probably fine. You want to put it on your belt and walk about 10,000 steps a day. That's the equivalent of a 20-minute workout. So there you go. You got your 20-minute workout. When you brush your teeth, if you're capable, do squats. As you're brushing your teeth, just do some gentle squats. You're supposed to brush your teeth for what? 2 minutes, right? Get an electric toothbrush. It has a timer on it. And brush your teeth and do squats. You don't have to go all the way down to the floor. Just little gentle squats. You're building up the big muscles in your back, your legs, your buttocks, and that's going to help stabilize your spine. As a chiropractor, what do we want to do? Stabilize your spine. So that's just another little trick that you can do. Housework. The other day I thought about going for a hike. It's a beautiful day and I had the day off and I thought I'm going to go for a hike. But then I thought, I haven't really done a deep cleaning in my house in a long time. So I did the floors and I did the windows and I changed all the bed sheets and I sealed my granite countertops. Guess what? That counts as exercise too. So do that. Go gardening if you need to. Just get out of the house and do something. Stress level is huge when it comes to pain management because when you're in pain, you're under stress. And when you're under stress, you have pain. There's 3 types of stresses you have to look at: physical, chemical, and emotional. The chemical you have control over. It's what you eat. It's the supplements you take. It's the people you surround yourself with. That's emotional, but that can be toxic as well. The physical, you may need to come see us for that. Neck pain, back pain, shoulder pain, misaligned vertebrae, muscle spasms. Come see us. And we'd be more than happy to meet with you and see if we can evaluate what's going on and get to the cause of your problem. And then physical, you have control over getting in motion. And if you fix the chemical and the physical, the emotional is a whole lot easier to fix. Now, we talked a little bit about the stomach, and you want to live a pain-free lifestyle. Your stomach's job is to take proteins and break them into amino acids. The amino acid glutamine, remember glutamic acid? You need a little bit of it, but when it's mixed with other amino acids, not by itself. The amino acid glutamine creates something called GABA. GABA is a neurotransmitter in your brain that suppresses pain. That's why there are pills named after GABA that are pain pills. It's really strong stuff. What if instead of taking an outside source of GABA, it stands for something, by the way, GABA, what if we just produced more GABA? Well, how do we do that? Make sure our digestive system is working. So if you have acid reflux, heartburn, burping, gas, bloating, we pull the stomach away from the diaphragm. In most cases, that helps you break your proteins down to amino acid. You get the glutamic acid. The glutamic acid then becomes GABA and helps suppress your pain. So when it comes to nutrition, you got to be in that Goldilocks zone. Not too much, not too little, just right. And that's why things like Super Greens and Essential Source, 2 supplements are on my website. I take them every day because I've worked on that for years to formulate something that's going to be awesome, help your body work well. And that's why I'm so excited about that. And that's why I take it every day, and that's why we ship it all over the world. In fact, there are sometimes we have run out in the past because we get bigger orders than we expected. So we're trying to balance that. But that's a great problem to have, that people want to get well. And you carry it with you. It's real simple. If it travels well, put it in a bag. You can mix the 2 together, put them in a bag, take it with you. Take 2 scoops, a scoop of each. Take 2 scoops if they're mixed together. Just mix it with cold water. I use coconut milk, ramen milk. Stuff tastes great. The nitric oxide is great for circulation, and that can help the brain function as well, and that's where you feel pain. You don't feel pain if you strain your wrist or your ankle in your ankle. You feel it in your brain, and the brain says it's coming from the ankle. Make sense? This is where we process our feelings. So that's why it's so important to take care of your spine, take care of all the joints. I sprained my ankle the other day. I was out hiking. I had bought some new shoes. They were really lightweight, and I stepped on a rock, and bam, I felt the muscle tear, and it was so painful. So I hobbled back, got to the office, grabbed one of my doctors. I said, all right, Dr. Irwin, work on my ankle. And he worked on my ankle, got it adjusted for several days in a row, and it healed properly, and it's fine. So any bone can come out of place, and getting it put back in place is really, really important if you want to live a pain-free lifestyle. And again, pain is just telling you something's wrong. Pain is not the problem. Pain is the symptom. So getting rid of the pain doesn't treat the cause, it treats the symptom. So bones out of place are really important because they affect how the body functions, and again, they'll rub up against each other and wear out. But if your stomach isn't digesting food properly, or you're eating too much food, or you're eating bad food, or you're getting older and your digestive enzymes are dropping, you may not be breaking your proteins into amino acids to produce neurotransmitters, which help control pain and make you happy and give you pleasure. It's all a bunch of chemicals, folks. You see somebody who's depressed, they got the greatest life in the world. You see these Hollywood stars on top of the world commit suicide. What happened? You've got everything, man. You got looks, you got money, you got fame. You have all the attention you could possibly want. What could be so miserable to take your own life? It's in the brain. The brain isn't working properly. And that's why we try so hard to get the brain to work normally. And if you have pinched nerves in your neck, you can cut off the nerve and blood supply up into the brain. So physical problems can create neurological problems affecting brain function. And then chemical problems can affect neurological problems, and that's how we perceive pain. Pain is a warning sign, nothing more than that. It's telling you something's wrong. Folks, got a lot more to cover, but unfortunately we're out of time. If you're just tuning in, you missed a great show. So the good news is this. It's going to be on my website, drjoe.com. So go to my website, drjoe.com. If you have a service that for podcasts, the podcast is named For the Health of It. You could look it up that way. We want to be your doctors. We have a team of doctors, and we have offices in the Atlanta area, Marietta, Duluth, and Stockbridge. We want to be your doctors. So stop suffering needlessly. Go to my website, drjoe.com, make an appointment. We can set you up usually within 24 hours. If next day is a business day, we can set it up right away for you. And bring your friends, bring your family. And I have to say this every show. If you've ever been in a car accident, if the car was damaged, you were damaged 100% of the time. So stop suffering, because suffering is telling us that there's something wrong. So go to the website right now, drjoe.com, set it up for you, friends, and family. If you have questions, send them to me through the website. I'm more than happy to answer your questions. We're there 6 days a week for your convenience. So again, the website, drjoe.com. I'm Dr. Joe Esposito. Thanks so much. Tell your friends about the show. We'll catch you next time. Thanks for listening to For the Health Bit. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.